Okay.
In Nigeria, here, Odubanjo et al. 2011, showed that the prevalence of chronic kidney disease is between 1.6% to 12.4%
In Nigeria.
in Nigeria. Then another study that was done in our region, southern eastern region, by Olasi et al. 2013, gave a prevalence of 11.4% thereabout
From the southeast.
from the southeastern region. So from these figures, you see that they are not a true reflection of the burden of chronic kidney disease. You know someone who have died of chronic kidney disease. I'm sure you know someone. I know a lot of people. So it is a monster that is underreported and also underdiagnosed, because people with this disease, they present late.
True.
They present very late at end-stage renal disease. That is when the estimated glomerular filtration rate is less than 15 ml per minute per 1.73 square meters. The normal is above 90. So you find out that most patients are presenting late when it's below 15 ml per minute per 1.73 square meters.
Okay.
Could you just tell us some of the causes of kidney disease? I've known a friend who died of kidney disease. Now he doesn't smoke. He doesn't consume alcohol. He has, in quotes, a decent lifestyle. Yet he died of kidney disease. What are those common causes of kidney disease, and what could easily be associated to it?
Okay. I would like to answer your question with a study by Chukwonye 2018 that was done in the southern eastern region. So it listed a number of risk factors that predisposes one to chronic kidney disease, and among them are hypertension, diabetes mellitus, obesity, family history of kidney disease, family history of hypertension, and of course, intake of herbal medication. So possibly your friend who lived a decent lifestyle could have suffered from hypertension, because hypertension is a symptomless entity. It does not have any symptom. Hypertension is simply systolic blood pressure above 140 millimeter mercury and diastolic blood pressure more than 90 millimeter mercury. So we are advised to maintain an optimal range of 120-80 millimeter mercury. So because it's symptomless, possibly he didn't know. So the kidney suffered from hypertensive nephrosclerosis, and that led to chronic kidney disease. So it's important we check our blood pressure regularly.
Yes, thank you, doctor. Okay. Concerning the end stage that you talked about, you said that people usually know when they have a kidney disease when it has gotten to the chronic stage, especially here in the southeast. So that gives me the idea that the kidney infection has stages. So what is the earliest stage, and how can it be diagnosed at its earliest stage?
Okay. According to the Kidney Disease Improving Global Outcome 2012, it categorized chronic kidney disease into 6 stages. We have G1, we have G2, we have G3, which is A and B. We have G3A and G3B. We have G4 and we have G5. So G1 is when the estimated glomerular filtration rate, that is the rate at which the glomerulus filters, things, is more than 90 ml per minute per 1.73 square meters. That's the stage 1. You can see the person is almost normal. That's why stage 1 and stage 2 are asymptomatic. Except there's a laboratory testing. in clinical setting. So by the time the person progresses to stage 3, stage 4, stage 5, by then the clinical and laboratory complications are overt. They are very prominent by then. So that's what we know, that we do blood chemistry, what we know as the estimated GFR. By the time you do the test, it tells you the state of the kidney, and as well what we know as the albumin creatinine ratio. That shows you the level of protein that is in the urine. Yeah, so that's more like one of the diagnostic portals to it. So in addition to the aforementioned symptoms, the kidney is responsible for excretion of toxic waste of metabolism. So when there is impaired kidney function, this toxic waste tends to accumulate in the body. So when they accumulate in the body, they could lead to what we term uremic syndrome. So when they now accumulate in the body, this waste that's supposed to be excreted, it could manifest in the brain as confusion. The person will be confused, altered state of unconsciousness. There could even be convulsion. It could also lead to heart failure. That's what we would call uremic pericarditis, and it's an indication, in fact, an absolute indication for dialysis. In the skin, the person will be itching all the time. The person will be itching, and as a result of the itching, you would see scaly skin, sallow skin appearance, or what we term uremic frost. You could see it in the person's skin.